Hi, and welcome to the next edition of Table Talk. I'm Pharmacist Barry Walton here at Max Medicine Mart. Today we're going to be talking about the newest vaccine that's out. It's called Shingrix. It's a shingles vaccine. We've had a shingles vaccine before. It was called Zostavax. The new Shingrix vaccine is much more effective, and that's why the ACIP, the Advisory Committee for Immunization Practices, and the CDC has recommended this vaccine even if you have had the Zostavax vaccine previously. So one thing we want to make sure people understand is what is shingles, and shingles is it's an infection, a viral infection of herpes zoster, and you get that in your body when you get the chicken pox. And that virus really never goes away. It kind of hibernates, if you will, and then as we get older and our immune system gets a little bit suppressed, that's all it takes for the virus to come back out. And when it comes back out, it comes out as shingles. In that regard, you cannot catch shingles from someone who has shingles, but if you haven't had chickenpox or if you haven't been vaccinated for chickenpox, then there is a possibility that someone with shingles could give somebody chickenpox. So I hope you can follow all that. If you have any questions, of course, we always tell you to talk to us and ask us about that. This new vaccine, as I said, the original Zostavax was, after about 4 years, is only about 50% effective. This new vaccine, Shingrix, after the 2-shot series is done, after 4 years, it's over 90% effective. So it's a huge advance as far as protecting ourselves against shingles. Shingles usually presents as a rash, and it can often be accompanied with blisters, and it usually lasts anywhere from 2 to 4 weeks. There's also a thing called postherpetic neuralgia, and this is the pain that can follow the shingles. And it can be very, very painful, so painful that you don't want to wear clothing because it irritates the nerve endings. You don't want to put if you lay down at night to go to bed, you don't want to have a sheet on top of you because even that little bit of friction can cause serious discomfort. So this is something that we all will have to probably deal with at some point in our lifetime, either ourselves or a loved one. If you live to be 80 years of age, you have a 1 in 3 chance of getting shingles, and shingles usually affects people over the age of 50. And that's important because that's who this vaccine is for, anyone 50 and over. So the first shot you would get, let's say if you got your first shot today, then in 2 to 6 months, you would get your second shot. There's a 4-month window for that second shot. And then that would be the complete vaccine series for this Shingrix vaccine, and you would be what would be considered fully immunized. The thing about shingles also that you want to make sure you realize with this vaccine is that it does cause some interesting side effects or reactions, if you will. There's shoulder pain at the injection site. This can be sometimes quite severe. It can be uncomfortable, especially if you sleep on your, for instance, your right side and you got the shot in your right arm when you lay down. That kind of pressure, you can kind of feel like a dull ache. Sometimes this goes away in 2 to 3 days, but it can last up to a week. And it is I can tell you from personal experience, I've had the 2-shot series, so I'm one of those people that did get soreness at the injection site on the first and the second shot. Wasn't debilitating, but it was just uncomfortable. So that's just something to consider and know going into the shot itself. And so that's one of the main things that we want to make sure you realize. You also might not feel very well. Some people get a fever or some fatigue, some shivering, almost like a little mild virus. But you can't catch shingles from this vaccine because there is no live virus in the vaccine itself. So we want to make sure people realize that. That's really the basics for the Shingrix vaccine. It's for 50 and over. It's a 2-shot series, and after 4 years, you'll still have over 90% effectiveness as far as fighting off the shingles. So if you have any questions, as always, we ask that you talk to the pharmacist. We can tell you exactly what the process would be, what your insurance company will pay for, what they will not pay for, and basically just talk to you and see if you would be a good candidate for the Shingrix vaccine. So please come on into Max Medicine Mart and talk to us about the Shingrix vaccine for shingles.